The conventional world of medicine aims at decongesting the cysts or surgically removing the cysts. We do not believe that that is the right approach, because there is almost 100% evidence of recurrence. What we aim to do when a patient reports to us with ovarian cysts is first to understand the circumstances surrounding the patient in terms of the medical history of the patient. We particularly are interested to know whether the person is under any kind of hormone replacement therapy, such as levothyroxine sodium, which is commonly used for treating hypothyroidism. We then put together a treatment strategy after a proper detailed case taking, which includes documentation of the menstrual irregularities that the patient may be experiencing. We do a treatment over a period of about 8 to 10 months. And this is required because we are not directly aiming to remove the cyst, unlike in conventional medicine where the physical cyst is actually mechanically handled. Here we are trying to give some oral medications, and even those oral medications are not aimed at simply managing the situation. They are aimed at achieving to leave behind a permanent correction in the system. We put together a treatment plan, the medicines start, we take a feedback from the patient on a month-by-month basis about what she is experiencing. So there are two kinds of feedback. One is what the patient is experiencing, that means the improvements that are happening and are being experienced by the patient after starting our treatment, and also periodically monitoring objectively what the machines are saying. And these would be, for example, blood tests, as I said, CA-125. If it is found that the CA-125 is on the higher side when starting our treatment, then that is repeated and it is taken as a parameter which indicates improvement. And the second is by repeating the ultrasounds. The ultrasonograms can be repeated, and we can measure the size of the cyst in the previous ultrasound and the newer ultrasounds. That gives an indication of, or rather a confirmation of the progress towards a resolution of the problem. The treatment is ultimately aimed at a complete rebalancing of the hormonal imbalance in the system, which we believe has led to the formation of the ovarian cyst. So it's not the other way around. The fundamental reason why all of these things have happened is what we are trying to address. So the fundamental reason at the systemic level, so that we are able to correct the problems that have led to these ovarian cysts from happening. The targeted treatment aimed at reducing the size of the cysts. And third, the symptomatic issues like menstrual irregularities, heavy flow or scanty flow, or there can be spotting in between two periods. There may be double menses. So all of these things are also addressed as part of the treatment without the need for using any hormone replacement therapies. So the treatment under our team of doctors is based on a definitive process that all of them follow as a team, and they can deliver the treatment as a team, either when you visit our clinic or you avail our telemedicine service.